The vulnerable population I will be discussing in this presentation is children. Children face a variety of factors that make them a vulnerable population. Essentially, they must rely upon others until they are a legal adult, and this can cause many unfortunate circumstances if the caregivers or families are of a lower socioeconomic status, abusive, neglectful, and/or a variety of other things. Factors that make children a vulnerable population off the bat and risk factors that make a child more vulnerable than they already are two different categories. These multiple factors, along with engaging, assessing, intervening, and evaluating this population, is discussed in further detail with child welfare specialist and social worker Nick Nasuda. There are many factors that contribute to why children can be considered a vulnerable population. In the United States, a person is not legally an adult until they are 18 years of age. This means that until they turn 18 years old, children must rely on their parents or caregiver for basic necessities such as food, shelter, and medical care. If a minor is not relying on their parents or caregivers for these things and are providing for themselves somehow or are not getting the medical care that they need in general, it shows a sign of abuse or neglect. Other signs of child abuse and neglect include the child showing sudden changes in behaviors or school performance, having learning problems or difficulty concentrating that cannot be attributed to specific physical or psychological causes, is always watchful, lacks adult supervision, is overly compliant, passive, or withdrawn, and/or comes to school or other activities late and does not want to go home. Along with basic life necessities, children also rely on adults for comfort. Children have developmental limitations since the brain is not fully developed until around the age of 25. Children mourn in different ways than adults and are less capable of verbalizing their emotions. The prefrontal cortex of the brain is one of the main primary reasoning areas, keeping emotions in check and serving against emotional impulsiveness. Since a child's brain, and thus the prefrontal cortex, is not fully developed at this age, they are more vulnerable to outside interference and less able to rein in their emotional responses than adults are. If an adult fails to provide the proper comforting a child needs or only encourages negative thoughts, the child tends to turn to runaway emotions and hyperactive fears. There are many signs to look for that point to abuse or neglect of a child. One sign is the adult not giving the child a chance to speak. This point will be looked at a little more closely later in this presentation. Other signs include the parent showing little concern for the child, denying the existence or blaming the child for difficulties in school, seeing the child as entirely bad, worthless, or burdensome, demanding a level of physical or academic performance that the child is unable to achieve, and looking primarily to the child for care, attention, and satisfaction of emotional needs. Along with actual signs between the child and parent that there are problems in the household, there are also many risk factors and indicators of increased vulnerability in children. Many relate to what children and family services throughout the country deal with and see when working with children. Social factors can include, but are not limited to, poverty, such as lack of food, clothes, shelter, and schooling, lack of psychosocial and emotional support, not receiving care, love, guidance, and support, emotional, physical, and/or sexual abuse, living in very poor households, unsafe environments, and exposure to crime, gangs, and drug use. Family issues that contribute to increased vulnerability in children include parents or caregivers who are alcoholic or drug abusers, children with parents in prison, low maternal age, unemployed or disabled parents, single mothers, emotionally disturbed parents or caregivers, overcrowding at home or a high ratio of children to caregivers in the home, divorced, separated, or single parents, abusive family, parents, or caregivers, and a lack of parental guidance and direction. To understand more about this vulnerable population, I interviewed social worker Nick Nasuda, who currently works as a child welfare specialist. Nick was able to provide insight into culturally specific ways to engage, assess, intervene with, and evaluate children he works with in his agency. In the following slides, Nasuda's answers and research information are put together to look into appropriate ways of handling young clients. When speaking with social worker Nick Nasuda, he explained that most of what the children he works with wants is to be heard because they feel dismissed when the adults are talking. Continuing with this, he explained that he sees a lot of adults not giving kids a chance to speak their mind, hence not giving them a platform to advocate for themselves. He engages this population by allowing them to speak for themselves, explaining their thoughts, emotions, and feelings in their own words without interruption from adults. Again, he presses that listening is the best way to engage these children. As Nick Nasuda explains, age plays a factor when assessing children. Younger children are typically very innocent and honest, so when asked simple questions such as, "What does safe mean?" after asking if a child feels safe, often provides very honest answers as to what the child's home life is like. Difficulties do present themselves, though, as Nasuda described how many times teenagers are more difficult to assess up front due to the traumas they have experienced. Struggling with their vulnerabilities on their own, without present or stable adults, before their brains are fully developed, makes them feel that they do not need anyone, since they cannot rely on their caregivers. This makes it hard for them to open up to their caseworkers or allow anyone in. Assessment of young clients continues through the life of the case as it is open, often allowing social workers to monitor the children in different settings. Younger children must also be monitored in person, as their behaviors often show cycles of emotions. In the agency Nasuda works in, they do integrated assessments that dive into the family's social history, which gives a lot of information to assess the children. In intervening with children in vulnerable situations, Nasuda explains that his agency follows recommendations professionals provide. He breaks down interventions into two categories, short-term and long-term. Long-term interventions consist of things like therapy and medication, where social workers learn new things about the children by working through these types of treatments. He explains a short-term intervention example as being in a crisis situation. A 10-year-old child is panicking in their foster home, yelling and unable to control their emotions. The foster parents may not know what the child is panicking about. In actuality, one of the foster parents poured a glass of wine, and that was a trigger for the child. Nasuda explained that when he is on call and must respond to these situations, he must listen to both the foster parents and the child, working with both of them in the short term to preserve placement in a crisis. In evaluating this vulnerable population, Nasuda described that with his agency and specific job, he is evaluating constantly. He evaluates how the families do, whether it be blood family or a foster family, and how the children do by the progress they make as they work through any of the services that are set up through the agency. Evaluation continues through the life of the case. Nasuda claims that there is really no specific way to evaluate in regards to this particular population.